Alexey Pankov. Yeah. He will speak about stenting, iliac obstruction, and embolization of the periprostatic venous plexus for pelvic pain in men. So we always speak about pelvic pain in women. So that's like interesting to see what is happening in men.
That'll work. If it has any problems, let me know.
Sorry, I did.
You can. You can also do this here,
Okay.
and your time will be.
Okay. Good morning, dear colleagues. Let me introduce our presentation. So it's my disclosures. I'm a consultant and proctor in Russia for Medtronic, Boston, and BT for venous stenting and venous embolization. So we know that pelvic pain in men is a very common problem. Often these patients are diagnosed with chronic prostatitis and they are treated with antibiotics, prostate massages, alpha-adrenal blockers, NSAID, botulin, and many other things. And often this treatment has no any effect. So it's a very interesting work of Clemente and colleagues, which performed pelvic MRI in 44 male patients with clinical history of pelvic pain symptoms associated with urinary, rectal, and sexual disorders in the absence of any bacterial prostate infection. And the most frequent finding was the dilatation of a periprostatic vein plexus. It's at about 71%, which was significantly correlated to chronic pelvic pain syndrome, regardless of different clinical presentations. So, but if we see in a guidelines or fantastic SVP classification about pelvic vein disease, we see that it considers only women, and we read it in SVP. Although chronic pelvic pain also occurs in males, there is currently little evidence to suggest that pelvic venous disease is an important contributing factor. But what we see in real life, we see a lot of men with pelvic pain who do not find any bacteria in their prostate, which have been treated by urologists for years and years without any effect. And many of them has pelvic vein dilatation, combined varicocele, recurrent varicocele, and non-thrombotic iliac vein obstruction. Look, maybe it's just pelvic congestion syndrome and we need to change guidelines for men. I think men lives matter. So to try to change this modern paradigm, we started to our investigation, and from October 2019 through August 2022, 27 men with pelvic pain and dysuria due to pelvic congestion syndrome, as we think, and with abacterial chronic prostatitis were treated in our hospitals. And 6 patients also had complaints of erectile dysfunction due to venous leakage. The average age of patients was 34 years, and the average pain level on the visual analog scale was 7. So all patients had dilated veins of periprostatic plexus and May-Turner syndrome, and all patients underwent CT phlebography with contrast and IVUS. So, and patients with erectile dysfunction and venous leakage also underwent CT cavernozography. It's total 6 patients. It's interesting method. So when contrast is injected directly into the penis through the needle, and so pathways of venous leakage are clearly visible, as we think. So what was the treatment? The first stage of treatment was May-Turner syndrome stenting with dedicated venous stents, total 33 stents. All stenting was performed under the IVUS control. After 6 months, in the case of poor clinical results, the second stage was performed by embolization of the expanded branches of the internal iliac veins and the venous periprostatic plexus, total 8 patients. Selective occlusion was achieved using a combination of 3% etoxysclerol and endovascular coils assessed through the veins of the arm. It's a cubital vein, cephalic, or vena basilica. It's more safe access than access through the dorsal vein of penis, which some doctors uses. So this is our results. Technical success was achieved in all 27 patients. 6 months after stenting, pain and dysuria reduction was achieved in 19 patients. 6 months after second stage embolization, pain and dysuria reduction was achieved in total in 24 patients, which consists of 89%. 5 patients from 6 with erectile dysfunction also showed the improvement, and 3 patients did not notice any improvement, and we have no any complications. This is one of our patients, 39 years old. He has severe pelvic pain for 5 years and very strong erectile dysfunction. According to this CT cavernozography, we see a very huge pelvic vein and with venous leakage from the root of the penis. And as we see it first time, we see, wow, what we'll do with it. But when we put a stent, like in the first stage, so 2 months after stenting, pelvic pain decreased from 7 points to 2, and patient was very happy. And we see in the CT after 2 months is a significant decrease in the size of the vein of pelvis. This is IVUS of that patients before and after stenting. We see the cross-sectional area in the compression zone of the left common iliac vein. Before stenting is 47 square millimeters, and after stenting 241. So it's 5 times more. And the second stage, after 6 months, we performed embolization of the vein of prostatic plexus with a coil center toxicosclerol. And currently there are no pelvic pain, and the direction has improved significantly. So what is conclusion? Stage non-thrombotic iliac vein stenting, obstruction stenting, and a retrograde embolization of the periprostatic venous plexus for pelvic pain in men is a safe and effective procedure. And the most pleasant and encouraging thing is that urologists see our results in patients whom they have treated for years and years without any effect. They begin to direct patients to us themselves. But of course, we need further research. Thank you very much for your attention.